Scrooge!
Who is it now?
I'm the ghost of your healthy oral cavity past.
Didn't my last ghost tell you that I'm not interested?
Well, I have come to remind you of your past anyways.
Fine.
You used to have a diet so light in sucrose, fructose, glucose, and carbohydrates. This provided very little nutrients for harmful gram-negative bacteria to thrive on, and your saliva was so serious and plentiful, so rich of lactoferrin, lactoperoxidase, lysozymes, IgA, minerals, and nutrients, creating an environment with a neutral pH, allowing your teeth to remineralize so rapidly.
Do you seriously think I care about any of this?
You should, Scrooge. Back when you used to take immaculate care of your teeth, your mouth consisted of primarily gram-positive bacteria. Remember how harmonious your oral bacteria was during these times? You had the Streptococcus mutans family with Streptococcus, Mitis, Salivarius, Sobrinus, Sanguinus, and Oralis. And of course, Lactobacilli, with Lactobacillus casei, fermentum, and acidophilus. The Actinomyces species, Urobacterium, Comodones, and
Captain side effect, gingivalis. Who cares? I thought all bacteria were bad anyway.
They can be, although the gram-positive bacteria of your past live mutualistically with your teeth and mucous membranes. Your saliva is able to monitor the harmful deposits secreted from these bacteria, and any of these secretions that your salivary glands didn't rinse away, you used to with your oral hygiene care.
Well, stop with all this nonsense anyways. I hate dental hygiene, and I hate Christmas, and I don't care about it at all.
Oh, Scrooge, I can only hope that the other ghosts can help you.
Act 4. Ghost of gingivitis present.
Scrooge!
What is it this time?
It is me, the ghost of your present. I am here to warn you of your current situation.
Oh no, it's fine. Stop pestering me.
You have a serious condition. You have gingivitis. You have large amounts of plaque, which is oral biofilm. You have mounds of calculus that is made up of calcium phosphate and calcium carbonate. There's some subgingival plaque all around. Your body is getting tired, Scrooge. First line of defense wasn't enough to stop all of your bacteria. Those little rods and cocci still managed to get into your tissues. The second line of defense is acting up in overdrive. In the second line of defense, diapedesis occurs, which is when vasodilation of capillaries happens to let out the monocytes and neutrophils so that they can rush into the site of inflammation. Inflammation is the beginning of gingivitis, Scrooge.
Well, that isn't sounding too bad.
The inflammatory response is a good thing that your body does for you. It's easy to detect inflammation by the cardinal signs such as swelling, redness, heat, and pain. The damaged cells and mast cells release histamine first, and then prostaglandins. Leukotrienes are then released by the damaged cells, which will attract phagocytes, and vasodilation will occur. The complement proteins will then come into action.
This is so boring. I'm not even interested.
This is exhausting for your cells, though. Your non-specific immune system is not going to be enough. The acute inflammation will turn into chronic inflammation if you don't smarten up. The specific immune system is going to have to come into action.
Act 5. Ghost of periodontitis future.
I'm the ghost of periodontal disease future. I don't think you understand the severity of the situation, Scrooge. If your gingivitis goes untreated, the infection can travel past your gums into the periodontal ligaments in the bone. Your gums are swollen, and they will stay that way until you smarten up. Your body is trying to get out of this mess that you stupidly got yourself into, and will destroy as many tissues as possible. You aren't looking at just gingivitis anymore. You will develop periodontitis. Along with it, your breath is terrible. All this bacteria in your mouth is causing a serious case of halitosis.
But I feel fine.
You may feel nothing now, but the inflammation can cause serious damage. All this inflammation is causing your macrophages to engulf microorganisms. The white blood cells are panicking because of all the inflammation, so they release several cytokines such as interleukin 1, 6, and 8, which damage your gums and the underlying bone, along with the tumor necrosis factor alpha. The TNF-alpha contributes to this tissue destruction. The subgingival plaque that will accumulate in these pockets provides constant exposure to these gram-negative bacteria, such as
Fusobacterium periodonticum,
Fusobacterium intermedia,
Fusobacterium nucleatum. Streptella intermedia.
Actinomyces. Trophomonas gingivalis.
Tenorella forsythia.
Tannerella denticola.
Trophanema denticola. Actinobacillus actinomycetum promigans.
Entamoeba gingivalis. Pseudomonas aeruginosa.
And Villanella.
Well, what does all that mean?
That means that the constant exposure will keep the inflammation going. So extensive that irreversible damage will be done.
Wait, what kind of damage?
Well, along with the cytokines, your body is releasing prostaglandins, specifically prostaglandins of the E series. These prostaglandins trigger osteoclasts to destroy your alveolar bone. The osteoblasts cannot keep up to replenish it. They also promote the overproduction of the matrix metalloproteinases.
What is that? What are those?
MMPs are enzymes that come from macrophages, gingival fibroblasts, and junctional epithelial cells. Normally, they just rid the tissue cells that need to turn over. But now, due to the overstimulation from all the inflamed tissue, instead of breaking down the infection, they will break down your tissues. One of these enzymes is collagenase. It breaks down collagen, which means the framework for your oral cavity. The alveolar bone, gingiva, and PDL all degrade. That means alveolar bone loss.
So what does that mean for me? How can I go on without these tissues?
Well, this causes gingival recession, pocket formation, tooth mobility, and loss of bone. There will be nothing left to hold your teeth in anymore.
No teeth?
That's right.
But food?
No teeth. How will you eat with no teeth? How will you look? Do you want the paper dentures?
Well, what can I do?
Your best bet is to see your dentist right away, before it's too late.
Act 6, the treatment phase.
Scrooge realizes his bad oral health and decides to call up the dental office. Ring, ring. Hello. Hi, this is Scrooge. I'd like to book an appointment with the dentist.
Oh, okay. I'll see you at 4:30.